Hi, my name is Hans Prenen, medical oncologist, and on behalf of my co-authors, I would like to present the data of the interim analysis of the OPTIMIZE phase 1 study. Let me first discuss the mechanism of action of the study drug, which is called mitazalimab. Mitazalimab redirects macrophages to an anti-tumor phenotype, resulting in degradation of the desmoplastic stroma surrounding the tumor. In a second step, degradation of the stroma surrounding the tumor enhances chemotherapy toxicity. And chemotherapy induces tumor cell death and release of tumor antigens. Then the tumor antigens are taken up by mitazalimab activated dendritic cells, leading to activation of effector T cells and anti-tumor T cell responses. The study was divided into two parts, and the first part was a dose escalation with at least 3 patients available for DLT per dose level. 5 patients were treated at 450 microgram per kilogram, and 6 were treated at 900 microgram per kilogram. The second part is a dose expansion with a Simon's two-stage design, with an interim analysis for stop for futility will be performed when 23 patients in total, including patients from both part 1 and part 2, are available for objective response rate. Mitazalimab is the first drug that patients receive after diagnosis, and in the first 21-day treatment cycle, mitazalimab was administered intravenously at a recommended phase 2 dose on day 1 and 10, and modified FOLFIRINOX infusion started on day 8. In subsequent cycles, treatment followed a 14-day cycle where mitazalimab was always administered 2 days after modified FOLFIRINOX. So let me focus on the grade 3 and more adverse events. And as you can see on this graph, mitazalimab in combination with modified FOLFIRINOX has a manageable safety profile. The overall safety profile is consistent with the side effects which we know from modified FOLFIRINOX chemotherapy. There were no new safety signals or evidence of additive toxicity, and also no deaths due to adverse events. An interim analysis was conducted when data from 23 available patients at the recommended phase 2 dose became available. Patients who have completed at least 2 treatment cycles of mitazalimab and modified FOLFIRINOX combination were regarded as available for the purpose of the interim analysis. The cut-off limit for stopping for futility is 7 or fewer responders, which means that if there are 8 responders or more, the study continues. As you can see on this table, 12 patients presented a partial response, so an overall response rate of 52.2%. Additionally, 9 patients had stable disease for a disease control rate of 91.3%, which is extremely high. Here you can see that 7 patients have passed 6 months on treatment, which is already a very good result. We have 10 confirmed responders, so the light green versus the dark green diamonds in the swimmers plot. And there's also very good lesion data, including 2 patients with 100% reduction in target lesions. In conclusion, mitazalimab plus modified FOLFIRINOX is a feasible regimen with a manageable safety profile. Mitazalimab administered at 900 microgram per kilogram in combination with modified FOLFIRINOX shows encouraging results in metastatic pancreatic ductal adenocarcinoma. And with an overall response rate of 52%, the OPTIMIZE study passes futility and continues to full accrual. Thank you for your attention.